Hi, Assalamu alaikum and good evening everyone. Thank you for visiting my channel again. Abdurrahim here with you. So we are going to start our next video, and this is going to be for the anatomy of the heart, anatomy, structure and everything about the heart. So for the students, you need to learn this anatomy very well if you are going to choose any field in the cardiology, because you need to know about the heart very well, especially the structure of the heart and also the relation of the heart with the nearby structures, if you are going to do anything in the cardiology. So especially echocardiography, you need to know it very well, because you are going to scan the heart. So what is the heart? Heart is a cone shaped muscular organ which pumps the blood throughout the body. You all guys know about it. Okay, so let's go beyond this. Heart lies within the thoracic cavity. So it's this is the thoracic cavity or chest cavity, you can say it. Heart is on the front side of the thoracic cavity, just beneath the sternum bone. This is our sternum bone in the middle, okay, where our ribs comes and attach. Okay, so this is the sternum. The heart is just underneath this sternum bone and slightly towards the left side. General saying is that the heart is on the left side, but heart is actually in the middle and slightly towards the left side. Okay, so just beneath the sternum bone, in front of the heart, this definitely the sternum bones and ribs as a security of the heart are on the posterior side. The heart is sitting on the vertebra. Okay, so that's the anterior and posterior surfaces. On the left and right, there are two lungs, and heart is sitting in the sorry, heart lies within the mediastinum. Mediastinum is the space between two lungs. Okay, left lung is smaller as compared to right lung, just to give more space for the heart to sit there easily. Okay, and then if you talk about the size of the heart definitely differs for a large person, large body surface area or small body surface area, but usually it's about the owner's fist. Okay, if you talk about the numbers, it's about 12 centimeter in length and 8 centimeter in width and about 6 centimeter in the thickness. These are the numbers, you need to memorize it. Okay, I also see them from internet, so you need to memorize it. So these are the main things about the outer structure of the heart, like relation of the heart with the outer nearby structures. Okay, now we come towards the heart itself. Okay, heart is living within a pericardial sac, within a sac which is called pericardium. So pericardium is the most outer layer of the heart, which consists of two parts. One is a parietal layer, one is the visceral layer. Visceral layer is also known as epicardium. If you ask me that how many layers of the heart, you will call it 3 layers of the heart, which is the epicardium, which is the inner part of the pericardium, and then myocardium. Myocardium is the muscular part of the layers which helps the heart to contract, and endocardium is the most inner layer of the heart. Okay, so these are the 3 layers. If you get inside the heart, as I told you earlier, that heart has 4 chambers. Okay, so the 4 chambers means 2 on the right side, 2 on the left side. 2 chambers are small, the upper 2 chambers are small, and lower 2 chambers are the big chambers. So upper chambers are called atria, so left atria, right atria, and the lower one are the left ventricle and the right ventricle. So how the heart functions? Throughout the body, deoxygenated blood comes into the right side of the heart. Okay, right side receives that blood, then sends it for the oxygenation, then it comes back to the left side of the heart, and then left side contracts it and send it to all over the body. Okay, this is the main main and general anatomy of the heart. We will definitely go into the deep anatomy once we will be doing a particular subject or particular topic. Then we will also read about the deep anatomy of the heart. This is the main things you need to know about the heart. Okay, once you are going to start, definitely once you will be studying more, you will getting into the echocardiography or any other heart related subject, then you will read it more. Okay, now I will show you these structures in the picture, so just to make you understand a little better. Okay, so here you go. These are the 2 pictures. This one gives us an information about the anterior and posterior surface of the heart. This is the heart, okay? And if you look at this one, this is the sternum, okay? The front bone sternum. The heart is just beneath the sternum, just beneath the sternum, and it lies on the vertebra. So the vertebra is the posterior side of the heart. Let's come on to this main picture. It gives us a lot of information. So as I told you, heart is a cone shape. So you see this is the apex, which is a cone shape apex, okay? And the broader space is on the superior side where the blood vessels are. It is in the mediastinal cavity, which is this cavity between two lungs, okay? And it is resting on the diaphragm. Diaphragm is a separation between the thoracic cavity and the abdominal cavity. So this is the most outer layer of the heart, which is called pericardium, okay? And if you notice, the left lung, as I told you, left lung is smaller as compared to the right lung, just to give more space for the heart, okay? So this is it. And then if you look, these are the signs of the ribs. So the ribs are coming and attaching somewhere here just to give frontal support to the heart, okay? So next I will show you one more picture, and then the rest we will discuss it in the next lecture. Okay, let's come to this one. Okay, I think you can also read it as well, but I can tell you that the most outer layer of the heart is the pericardium, which is this one. Okay, this is the pericardium. Okay, it is consist of two layers. One is parietal layer. Okay, you see this is two layers, parietal layer, and the other one is the visceral layer. Okay, so visceral layer is also known as epicardium. So you see this one, this is still the full pericardium, okay? Then this comes in, which is a muscular layer. This is the myocardium, and then the most inner layer is endocardium, as I told you, okay? If you look inside the heart, this is, for example, right side, and this is the left side of the heart. Okay, right side, this one is your right atrium, this one is right ventricle, this one is your left atrium, and this one is your left ventricle. So these are the main chambers, and also the main layers of the heart. So this is how the heart looks like. Okay, this is the apex of the heart, and this is the base of the heart, okay, which is quite broad. So this is all done. As I told you that this is not a very detailed information. Definitely we will discuss the details when we will be doing a proper lecture about one particular topic. So I'll see you then. Thank you. Bye bye, and keep subscribing, and please share it with others as well. Thank you. Bye bye.